Hello, I'm Roberta Russell. The image you see is me a few days before I had an operation called hip resurfacing by Dr. Edwin Su. I was particularly thrilled to get this operation because they don't normally do it on women my age, and it's a lot less invasive than hip replacement, which is the traditional operation used for hip arthritis, osteoarthritis, where the cartilage is worn away, which mine was. I didn't get this way immediately. It took many years, and I'm going to show you how my limp progressed and a picture of the x-ray of my hips around the time of the limp so you can see how I got there. This was in 2010, and I'm walking in the country in Meredith, New Hampshire, and you can see there's a limp, but it's not as severe as the limp you just saw. And then you're going to see a picture of my hips by x-ray, and there's a space between the ball of the hip and the cup or acetabulum, and you can see there's very little space there. That's normally where your cartilage is, and mine is largely worn away, and the body developed spurs, which are osteophytes, and that's to protect itself, but basically they get in the way of your mobility. That's a side view of the same thing. So you can see that's 2010, and it's very worn away. However, in 2012, you can see that my limp was a lot worse. And in the year of 2012, it progressed rapidly, so that it really was getting hard to get around. You'll also be able to see that my x-ray changed as well as my limp, and there's even less space between the ball of my hip and the acetabulum. And also, the soft spots develop. All this is the body's efforts to defend itself against the wear that bone-on-bone arthritis causes. Surprisingly, I was not in pain, but my walk was like a penguin and back and forth to side. The way I found was through Dr. Su. I was pretty hopeless because at age 68, I wasn't a candidate for hip resurfacing, which was a lot less invasive than hip replacement. But my bones were good, and Dr. Su took me on. My treads. They hooked me up to something. She'll let me know when I'm okay.
Yeah, you still have
great.
hotel.
You can take a still, you know.
House with the river water.
Look at the view, though.
Nice.
Are you going to be late then? Take the dive.
Yes.
No problem. I
Have
did
you
the
ever
iron
never
on
fallen in the last? We'll do it again here.
Yes,
All
I
right.
also fell in the garage, also related to the flood. Lost my balance changing from house shoes to yard shoes. That's, you know, when it's really ugly and mucky outside. That's why I'm trying to.
Okay, no more picture.
Without.
Please.
That's it, Harold.
That's it.
Do the crunch last. Good leg. Crunch. Operated leg. Good leg. Crunch.
Doing business.
Operated leg. Good leg. Crunch. Operated leg. Good leg. Let's turn. We're going to do it one more time. Up and down.
No more crutches. This way you do
So now,
operated leg,
good leg.
a good leg.
Operated leg. Crunch.
Good leg. Okay. Great. That's great.
Got it.
Got it.
Good job. How do you feel
All
doing
right,
that?
good.
All right.
Good.
Head's okay?
That's okay.
All right. Let's put one crutch back on the other side. And our head back.
And back. Okay. This is the good foot, no, bad foot first.
Bad foot first, right?
Neat. Great. Put the light on even behind you.
Good.
Water walking, easier. Feels great.
Good.
While you do computer work or internet or video editing, this is my video editing table. But you can do a lot of things while pedaling, and after a while you don't even notice you're pedaling because of the circulation. And actually, if you adjust the tension, it's even exercise. It moves though, gotta find a way to keep it steady. I think I'm looking for another mat that doesn't move as much. Still, this is quite a treat. This is without a cane, but when everything's fixed, I shouldn't. For a treat. With it, or it stops being accessible to change.
The sooner the better. You have to allow the healing that has to occur, so you know the scar has to close up and heal.
Otherwise it would hurt.
Right, or you would disrupt that, and you know you'd have an open wound, right? And then you want to get onto it as soon as you can. Otherwise, those adhesions just get harder and harder, and harder to break up. So
Take your walker over to
addressing it right away is crucial.
No, the other table.
Sounds good. Yeah, exactly. We keep an eye on all those things. I'm gonna also, keep you nice and comfortable during the surgery just by some sedation through the IV, and that'll be about it. You'll breathe with some nasal oxygen, no breathing tube.
And just to remind them to give me blue at the end, not
Oh, okay. Did you have?
swim fast?
Oh, good.
Yeah,
That's right. I'll
yeah.
remind
Yeah,
Dr.
'cause I like to
Sue of
swim. We have
that.
it in
Yeah,
the
we'll get the
school.
Dermabond.
I heard you can do that right away.
You can do it pretty quickly, so that's
Yeah.
good. Great. And on the back, what you're consenting to are all the things we talked about. Sedation through the IV, the combined spinal and epidural, the arterial line, which is that blood pressure monitor, and then the lowering of the blood pressure.
Okay, so I'm going to place my initials here, so I expect you to do just as well, okay? Just to warn you, each hip is different in terms of what you feel, in terms of how it recovers.
We're gonna make a movie. It's amazing. Where's my lip gloss?
Where's my lip?
They
Well, you look great.
They gave me a pain thing. You push this, but I didn't have to push it.
It's like wiggle them.
You're having a lot of pain?
Great.
Here we are, day 2, and going home. I'm happy to say. This is day 18. I'm hoping to get rid of a sweet touch. This is an amplifier. This is the speakers. So I'm saying I'm the oldest woman that ever did.
Yes, you are. Great, great. All these people around, the dogs and everything. It's fantastic.
Well, you did it. I mean, it's amazing what you do. I just can't believe. It's
You're
like a miracle.
Great.
And I was going to have to go to England, where who knows what he would have done, because you wake up and you have a replacement, and sitting in England for 3 weeks, and paying a fortune. This is 23 days after the first operation.
You walk it, that's about a month.
Yeah, right.
That's the one.
And this I put for $30. You can buy this, stick it under your high desk. You don't even know you're moving. It's cheap.
I'm going to be bending this one out like that. Yeah. So if you keep doing that, that's going to help the rotation.
Really?
Yeah.
Okay. But that bends pretty far.
It does. So you can try it again sitting up.
You said do number 4. That's close to the
Yes.
Sitting up
Sitting up.
in the pool.
And actually pressing a little bit.
Okay, that'll help.
Yeah, that helps rotate the leg out,
Okay.
which is good.
Oh, okay.
This is more discolored than this.
That's
right.
funny?
This is crazy enough. This didn't get that color.
You know, that's still swelling.
And this got much more swollen than this one.
Yeah. This different size of swelling.
So this is a scar.
Combined spinal and epidural, the arterial lines, that blood pressure
Really
line.
good. So just
And the other scar. Yeah, and the other scar, how is much better.
Yeah, that's really
Just to warn you,
This is that you talking, see?
You got it all.
You're very photogenic.
She's doing amazingly well.
You're doing it.
Amazing.
We're a big team. So you saw your X-rays.
Yeah, I'm gonna go get them and put it. Go ahead.
But why don't we, maybe, do you want to do it after
Whenever
your
you want.
next, maybe your next visit? I mean, I
Okay.
think Roberta's
When's the
doing.
next visit?
It's going to be in 2 months.
Okay,
I want to
so
check
by-
healing beautifully.
Thank you so much.
Okay.
Then making a video makes it more interesting.
That's great. You're doing great.
All right, thank you so
Okay.
much.
So see you in a
Okay.
couple months.
Okay, great, thank you.
Turn around and go away. Okay.
Next time I'll
Post.
While you're up, let's have you, are you taping already? Huh?
Yes, of course.
Go ahead. Let's see you walk. Okay.
Yeah. So it's such a big change, right, Miss Russell?
Gosh, it's
From before?
incredible.
Yeah.
And I feel stronger all the time.
Yeah. You're going to keep getting stronger.
It's amazing every day, and I'm doing to have a wonderful physical therapist.
Great. That's
And
really,
every day I work
that's
with
really
new muscles come out that I never knew I had.
Most important is that you're a hard worker and you're going to be diligent about your exercise.
Yep, very diligent.
Okay, so I saw a big difference with the gait. I still think there's going to be more improvement. So basically the muscles along the side of your hip will continue to get stronger, and then you'll limp less and less. So
I see.
you're limping much less, but the muscles have been weak for a long time.
Yes.
So they just need time to recover. Okay?
So what do you think needs work?
So it's going to be the side raising
Side raising.
exercises, and
Uh-huh.
I'll show you again how to do that. Let me see
Okay.
you stand on your left side. Great.
Oh, wait, I'm falling down.
Okay, so that's a little bit of
Yeah.
balance and also muscle. You can do the opposite, and you can hold on to me if you like. Okay. I think this muscle is a little bit weaker.
This one,
yeah,
right.
Yeah, even though that was first.
Yeah.
But that was worse to start with, so
Yes,
I think it's still.
even
a
though it
little
wasn't
bit-
worse on the X-ray.
Right.
And the other one was worse on the X-ray.
Right, but
Very
you know,
strange.
I'm gonna ask you to lie down. Whatever you feel is the more painful hip is the one that's gonna be,
Neither of
weaker.
them, nothing hurts
that's true.
at all, so I don't have that problem. And I can go 6 miles.
That's fantastic.
Yeah, I know, it's just
You
amazing.
feel a lot better than before.
Oh, yeah, and I was a lot more optimistic. You know, it was so depressing to get worse and worse.
And the good thing is we're doing everything carefully, you're being very sensible about it, you're not overdoing it. So your motion's fantastic.
So,
Much better than before, right? You can
oh, my,
put on
couldn't
shoes
get
and
on,
socks.
couldn't get my leg over a bike before. Now I have a new bike and can ride with impunity. And
That's great. So this hip is more mobile, which is expected because it's further along in your recovery.
Uh-huh.
This one's very good though. It's very good. This motion could improve a bit,
uh-huh.
flattening it. That's the IT band stretch. Okay,
IT
so the motion.
What does that mean, IT band?
IT band is your iliotibial band. It goes
I
from
see.
here to your knee,
I'll look it up.
and it's stretched like that.
I see.
Okay, a lot of runners and people who ride bikes can get IT band soreness or tightness. So
Uh-huh.
this stretch is really good.
So do this.
Yeah.
And lying
I'll
down.
stretch- it's
Not
actually
sitting up.
sitting up. So for the IT band, you want to cross your leg like that
Yeah, which is I do in a sauna.
and
Goes
give
for-
it a little pressure. Okay?
Uh-huh.
So you see how far this is from here? It's not
Yes.
bad.
So it should be flat.
Could be flat.
Could
Let's
be
see this
flat.
one. Different people are different.
Uh-huh.
But
This
this
is
one's,
worse, I thought. Look,
I'd say it goes a little bit more
you
easily.
think? This is
so.
further big distance.
Both of them could use a little work.
Uh-huh,
Okay.
okay,
Let me show you the side raising exercise. So
okay.
you're going to lie in
Here, can I
either
put
side.
this down? Okay.
So go ahead and lie on one side. So I'm just going to come behind you. All right. So this is the best way to exercise the muscle.
Like that.
Is yeah.
You do that with 2-pound weight.
Good. Now you have to be properly lined up. So it's easiest to do it when you're lying against a wall.
Oh,
The
really?
shoulder against
Okay.
the wall, butt on the wall, heel on the wall.
So
and
do
then
it
you
on the
trace-
floor on a pad.
Yeah.
I
And try
see.
to go as high as you can, and then slowly up and then down.
I haven't been doing that.
Keep that heel against the wall.
Uh-huh.
Okay, that keeps you well lined up, and
I
that's
see.
gonna
I see. I
gonna
didn't know that.
decrease the lengthening. All right, let's try the other one. So lying against a wall just makes it easier to line it up.
Uh-huh.
So go ahead and do that.
See, I can't even tell that I'm limping, which is odd.
It's very slight. I mean,
Yeah.
compared to before, it's
Oh, compared to before.
it's much improved, but I want you to be perfect.
Okay, me too.
Okay. So it looks very good. Your strength is coming along well, your motion is fantastic, you're walking well, doing everything right.
Well, thank you.
Yeah. So basically at this point you can start to do all the things you want to do. Riding horses,
Really?
playing golf, playing tennis,
Uh-huh.
you know.
My goal is to learn to rumba, which I couldn't do
Rumba.
before
Okay.
anyway, so.
Okay.
so
That,
a whole other
I
thing.
think that'd be good for your hips.
Yeah, it would, if I
Yeah.
get that far, yeah.
Yeah.
I'm gonna try.
Well, I know you're gonna get there.
Okay, well, thank you.
Yeah.
Is it all right if we use the video on a cable television?
Right, sure.
That's okay? Yeah.
Yeah, absolutely.
yeah,
I
okay,
think
great. Do you think,
you
is
can
there
share a
anything?
lot of your knowledge.
Well, most people don't know about this
Right.
operation,
True.
resurfacing.
True.
And you are the major show in town and probably in the country. And, well, in women, particularly who have weaker bones in general,
Yeah.
are not eligible, so.
Right. So to speak to that, we really want to do the best operation for everybody, to last the longest, to give you the most function,
Uh-huh.
and to have the fewest complications. So
Right.
it's a different choice for different people,
So
depending
what
on
would you
those
say to somebody
factors.
who's normally not? Would you say to check out their bone density or?
Yeah, so I think the major thing is to come in for an evaluation,
Uh-huh,
get some x-rays, look at the structure and size of your hips,
uh-huh,
and then one of the factors, particularly in women who are older and older than 65,
uh-huh.
is to look at bone density. So I'm sure you realize through, speaking with surgeons and doing your research, that you fall outside of the normal age range
Certainly do,
for this
yeah.
procedure.
I was prepared
yet,
to go anywhere in the world.
Yet it's worked beautifully for you, and you've accomplished wonderful things, and it's still going to keep getting better. But not everybody is a candidate for the procedure, and not everybody's going to do as well as you are. So a lot of it has to do with bone density, the structure of your bones, your motivation in your recovery, how careful you are with your recovery,
Uh-huh.
and also what you want to accomplish out of the hips eventually. So a hip replacement is still a wonderful
It
operation.
sure is, yeah.
And I think that would have also provided you with wonderful results. Certain things that you wanted to accomplish, which are preservation of bone and a really stable hip joint and a good range of motion, are better accomplished with the hip resurfacing. So that's the discussion that we would have with all the patients before surgery.
Do you think there's any difference in the longevity of the?
I think it's at this point difficult to say. In men, for example, hip replacement and hip resurfacing at a certain point are kind of on par with one another. But in women, we are seeing that the revision rate for resurfacing is higher
Uh-huh.
than a total hip replacement. So that's
So it
something to
could not
consider.
last as long.
Correct.
Yeah. And
Could
what
not last
what are
as
the
long.
chances? Do you have any?
The data for approximately 10-year results is that a hip replacement in a woman would last 10 years 97% of the time, and hip resurfacing in that same woman in 10 years would work 94% of the time.
So it's 3% difference.
Yeah, it's only 3% difference, but if you look at it another way, it's twice the amount
Of dropouts, of fallouts or
Right,
whatever.
right.
Yeah.
So we want to consider it carefully.
So you have to
Yeah.
be paused before you
Correct.
trade off for what you think might be more mobility.
Correct.
But the advantage is that if you need to revise it, you still can get a hip replacement.
Correct. You got it. The other factor, though, as you've researched, is that some people react to the metals, and we can't predict who that's going to be. So that's something that is potential cause for failure.
So with
Especially
the people
in women.
reacting to metals in hip resurfacing, with Birmingham hip replacement, does that have any advantage over other manufacturers?
Well, the Birmingham has been is the most successful hip resurfacing. You know, they have a metallurgy, or the types of metals and the composition of the metals is based on historical implants from the 1950s, so they've been very successful and they've done their research.
So if you do your prediction on statistics, just with Birmingham, does that make the difference, or any difference, or is it not done?
The Birmingham has been more successful than other implants in the literature, yes.
So does that mean anything, if you say women are twice as likely to fail in 10 years, is that also true with Birmingham, or is that not
Yes, it's
even
also
still?
true, yes.
Yeah, in spite of whatever is reported from the people who developed it?
Yes.
Okay,
You know, these are large studies, nationwide.
and they just break it down and look?
Registries, yeah.
Right.
Correct. So, still something to consider carefully,
It's
but
something
it's a
to
good
consider.
option for people like you.
But if it were you, you would choose the replacement?
Do you mean for you?
No, if you were in a position, like my position,
As
not
a,
now, I
as
mean,
a-
now, of course, it's after the fact to
As
some
a
extent.
woman who.
Yeah, as a woman,
Well, I would tell you that there are advantages to each one, so.
so you wouldn't be able to make that decision
Yeah,
unless you were in that place.
That's the thing, it's
You
hard
don't
for me
know.
to make that decision for you, but presenting the data to you, I would tell you that your risk of revision with a total hip replacement is lower at 10 years than with a hip resurfacing. But that's not counting the functional benefits. So if that resurfacing let you do more for the 10 years than a total hip replacement, that might be worth it to you. And then, as you said, we can always go.
Is
to a
there real
total
evidence that
replacement.
it lets you do more?
There's starting to be more and more evidence that yes, it does allow you to do more activities with a more normal gait pattern and a higher stability rate, yes.
I see.
Yeah.
Okay, well, I guess that explains it,
Right.
to anybody who's interested.
Right.
Okay, thank you
Yes.
very much.
My pleasure.
Well, I'm very happy with the choice
Great. Thank
thus
you.
far. In 10 years, maybe I won't feel that way, but right now it seems
Years are
terrific.
gonna last a long time.
I hope so. Anyway, I'm going to use it well.
Okay, yeah.
And thank you very much.
Yeah, thanks.
Okay.
That's fun. Good, so I think you're doing well, Roberta, so just keep working on that.
I will.
Now that new one, that side raise. It's
Yes.
best lying down.
Okay, I will change what
Okay.
I'm doing.
A little bit more stretching, I think.
Uh-huh. Okay, well,
Just
thank
pass
you
it
so
on.
much. It feels
Okay.
wonderful, really.
So we should see each other maybe in another 6 months.
Okay.
Or close to our anniversary, I think, of the.
Okay, of the first one.
Yeah.
Okay,
Okay.
very good.
All right.
That would be about.
Great,
yeah,
so
okay.
at that.
Hello, doggies. Feels great to run.